Let's go ahead and get going. Welcome, everybody. First thing on our agenda, if everybody, first thing, if you didn't get a chance to sign in, we should probably pass that around. And then, so the first thing we'll get to is the roll call, counties, and introductions. I'm Paul Merton, I'm supervisor from Buena Vista County, and the chairman, and then we'll go to the right here, and we'll just go around the room.
Preston Schubert, supervisor from Ida County.
Scott Jacobs, Kelly County.
Neil Bach, Carroll County.
Jeremy Taylor, Woodbury County.
Dennis Butler, Woodbury County.
Louise Galvin, coordinator in the region. John Nutzer, CEO. I would like to point out it's Lisa Virgo's birthday. So, it's her birthday today, and she brought cupcakes, so help yourself to celebrate her birthday. I'm Felicia Bates, I'm the ISTRIP program director.
Audrey Larson, Superintendent of Health. Kim Wilson, Jackson Recovery Center.
Kim Caliber, Plains Area Mental Health.
Julie Albright, Woodbury County. Teresa Yoakum, Woodbury County.
Lisa Mayer, coordinator for the region. Lisa Bringle, coordinator for the region.
Melissa Drake, Plains Area Mental Health.
Sandy Biegel, Genesis Development.
Diana Osmond, Ida Services Inc.
Jerry Ricky with ITP.
Carrie Jones, Stewart Memorial.
Joey Warner, New Perspectives, Carla Monernat, Counseling Services.
Eric Wyckoff, Recovery Center.
Brent Wilhelm, Sac County.
Dennis Bush, Cherokee County Supervisor.
Cecil Bloom, Crawford County Supervisor.
Okay, again, thank you everybody for coming. I see a few new faces, so if anybody, we're pretty informal here. If anybody has a question or anything we're discussing, just we'll get you in. Next up then is the minutes of the previous meeting. Those should have been sent out, or you should have gotten them, and there's also a hard copy. Does anybody want to make a motion to accept the minutes as published or provided, or is there some changes that need to be made?
So moved.
Second. I have a motion from Cecil, a second from Dennis to approve the minutes of the previous meeting on February 20th. Any other questions or comments? Excuse me. Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion will carry. Okay, next up is the approval of the agenda, and I hope everybody got one on the way in. Do we need to make any changes to the agenda, Dawn?
Yes, we are going to add Felicia Bates with the iStart program. She's going to provide us an update, so that can go under item 7C.
Okay. And that's all we have? Okay. Is there a motion to approve the agenda as amended?
So moved.
Thank you, Kristen. Is there a second?
Second.
Thanks, Brent. Okay, so we have a motion and a second to accept the agenda as amended. All in favor signify by saying aye.
Aye.
Opposed, nay. That motion will carry. At this time, we do set aside a portion of the agenda for comments from the public. We'll let anybody that wants to speak on anything that's not currently on the agenda. You're more than welcome to. Is there anybody that would like to speak under the Hear the Public portion of the agenda? Okay, seeing none, we'll move forward to item number 6, unfinished business. Subtitle A, monthly financial report. And we'll let you go ahead, Dawn.
Reviewing your packets. We started with beginning cash balance for March. I'm sorry. This is the February report. Never mind. February 1st with $3,375,514.61, and we received total revenues in February between the counties and the region of $198,629.24. Our expenditures as an aggregate were $248,531.24, leaving us with a fund balance of $3,325,612.61. The only concern that I had about this report was Ida County's low balance. I did contact Lorna Steenbach about that yesterday. Just asked her if she felt that with the taxes coming in this month, that they would be able to make their quarterly payments to the region, and her response was probably not. She said she would know more on Monday or Tuesday. So I'm hopeful that they receive enough tax collection to be able to make that fourth quarter payment. Their total payment is $41,910, and I didn't have access to a report to see what their collections were in September, but from what I had anticipated for their ending fund balance, they should receive enough taxes to be able to make their fourth quarter payment. So just wanted to note that.
As long as they're not delinquent or
Right.
that's. Okay. That takes care of the monthly. Is that all you have on that, Dawn?
Yeah.
Okay. And then we have action on that, right?
Yes.
Is there a motion to accept that financial report?
So moved. Second.
Okay, thanks Scott. Thanks Neil. A motion and a second to accept this report. Any other questions for Dawn on that?
I guess I got a question. What happens if they cannot, the county does not collect enough money to make that payment? I mean, I don't really know the process.
Well, whatever they have coming in, the fortunate thing is that Ida County doesn't have any staff to cover salaries for, so whatever they would have coming in delinquent taxes would have to be advanced to the region up to that amount. Now, if the legislation for the mental health system changes and they feel that they're going to fall short, they can recertify their budget and make that up in levy next year. So that is an option.
Good question.
Thank you.
Any other questions for Dawn? Okay, hearing none, I'll call the vote. All in favor signify by saying aye. Opposed, nay. Motion will carry. Next up is status of the request for ITP reimbursement from the hospitals.
Okay, this is a follow-up to our discussion last month when we met about the hospital's cost-sharing ITP services with the region, because it was very important to hospitals to have a doctor-back referral for the evaluations that they are providing and making those referrals to hospitals and recommendations. So when Kim Kelleher, Jay Rickey, and I and some other staff met with the hospital representatives back in February, I had proposed that if that is their preference, that they cost share with the region, because we are fully funding the cost currently. I have reached out to 6 of our hospitals within the region, and I have received confirmation of the ability to cost share or willingness to do that by 4 of the hospitals. War Memorial, meaning Regional Healthcare Center, Loring Hospital, and Crawford County Memorial Hospital. They have all of, or not Crawford, I'm sorry, Stewart Memorial out of Calhoun. The 2 that I'm waiting for responses from are Crawford County and Cherokee Regional Medical Center. I have sent follow-up emails to them. I've heard back from the representatives I emailed. They are still they're still in the process of taking it to the powers that may be. And I'm hopeful that they are able to respond and make this equal across all of the hospitals, that there will be contracts with cost-sharing this year. Now that being said, I'm going to turn it over to Kim, who's going to talk about what she and Jay are working on in terms of billing methodology that may lower the costs that we pay for those evaluations to IPTP.
So Melissa Duray and I met with Jay and Doug from ITP. So we're trying to figure out if it was under Plains Area's umbrella, then we would be able to bill for those services provided to the hospitals. Well, in looking at processes and trying to figure that out, it's a lot more complicated than I had originally thought, of course. People that actually do it are coming back with a lot of things that we will have to overcome. One of them is using 2 different systems. So ITP has their own telehealth system set up, and if we are the ones billing for those services, it needs to be in our system. So that is one huge hurdle that we would have to overcome. Another issue is the codes that the hospital bills when somebody's in the ER. So those may conflict. If we bill on the same day, even though they're completely different codes. We are working through some of that. Our biggest issue with that is Medicare. So there are still a lot of things that need to be worked out, and to be honest, it may or may not happen. That's kind of where we're at right now. If we can't actually bill for those services, there's no sense in doing it. So
Yeah.
we're working through those issues. Any questions?
Does anybody have any questions?
When do you think you'll have this resolved?
I'm hoping in a couple of weeks. I've got my billing manager working on that, and CFO working through the billing side of it and some of the EHR side of it.
Anybody else? Any questions? Thank you. So that's just an update on that, so we're fine there. Okay.
I was very pleased in the responses that I received from the 4 hospitals that are willing to contribute towards the cost. And there were no questions, just that they were very much committed to the service and the value that it's added to their hospitals, and were totally on board.
Good. Okay, anybody else have any questions for Dawn on this? Okay, good enough. Next up then is the status of the Rolling Hills Woodbury County transition.
Okay, so just to go through a few things that have transpired over the past month in transitioning Woodbury County into our region. I believe as of yesterday, the Sioux River region issued notice to Woodbury County of termination of the contracts between the existing staff and Sioux River. I had the opportunity to go out back at the end of February and sit down with all of the staff. Spent a few hours with each staff just trying to understand what their role is in with the Sioux Rivers in order to determine how many staffing were going to be placed within that office and what the needs were. And I thought that went very well. I think that when we get more into the detail, I can talk about what we're designating. But I just want to give you an overview of some of the other things first. I have completed the annual service and budget plan that we're going to be discussing a little later in the meeting that you will need to take action on. I had to revise the plan and develop it with Woodbury County providers included in, as far as there's crisis planning, budgetary numbers for Woodbury County, and making sure all the access points are designated for Woodbury County as well. So that is done. Just we need to go through that later in the meeting. I was also able to look at their financial position. That was to be determined by the end of this month, and I contacted Aaron Haverty with Sioux Rivers on March 7th, and they were estimating that Sioux Rivers would end their fiscal year with $2,134,448, and in prior governance board meetings had agreed that Woodbury County's portion would be 61% of that amount. So if you look at 61%, Woodbury County would be exiting Sioux Rivers with $1,302,013, and that's Aaron's estimation. Now, more than likely will be higher because they have had staffing changes that they are not paying for. So with the staffing changes and then Aaron's position, Aaron is leaving on Friday. Because of that, it could be a higher amount, but that was the figure that he gave me as of then. And I know in talking with Dennis Butler, he felt that it could be much higher than that. So
What was that figure again, Don?
$1,302,013.
Thank you.
Some things that we still need to work on are in the next couple of months, transferring billing processes to Buena Vista, where the fiscal agent is located. We're going to need some regional applications for Rolling Hills, especially for those that are receiving 100% regional funded services. And in terms of the 100% region funded services, the one thing that I can say is that I've had a couple of meetings with Siouxland Mental Health Center just to really identify how that process is going to work. Because with Plains area, they have not really sent us any applications since the Iowa Health and Wellness Plan went into effect. They have done a phenomenal job of making sure that people have access to Medicaid applications, and they receive our block grant, but they are not expecting us to fee for service on top of that. And so I met last Friday with Joel Peterson, the Chief Financial Officer, and a couple of his staff, and we were able to come to a common understanding that this is what the new process is going to be going forward, because I have learned that Sioux Mental Health Center is doing applications as a rule of thumb, essentially, for anybody that's coming into services on average, possibly up to 100 applications a month. And if that is going to be the case, it's going to inundate our staff with applications that we're not necessarily going to need. So we were able to work through that and come to a common understanding. So, and then I followed up with an email to Joel just to outline everything yesterday so that we have that in writing. And then, of course, the management plan. We need to amend our management plan, and that has to be due to the commission probably by the middle of May. So I should have that ready for you at the April meeting, because that has to be approved by the director 45 days before it goes into effect on July 1st. So need to amend that to make sure that we have all of our processes identified within the management plan. There shouldn't be some, any major changes, because we're not changing how we offer services. It's just making sure that what they offer for services is clearly identified within our plan, and it shouldn't be too bad to get that done, and I should have it ready for you by the April meeting. So, back to the staffing positions. After meeting with the staff, I have determined that there will need to be 3 positions. Right now, they have 6 FTEs between a position that is vacant, their jail alternatives position, and then Julie is the funding coordinator, and Anna serves as the billing coordinator. Teresa is designated as a service coordinator, and then they also have a mental health advocate. And I'm looking at 3 positions, so a mental health advocate definitely needs to be a full-time position because of the amount of cases that they have in Woodbury County. Lots of open cases that probably need to be cleaned up. I'm also looking at a full-time coordinator position, and I think that right now, if you consider that we have 3 coordinators for our 7 counties on capital population to Woodbury County, definitely think it warrants a full-time coordinator, possibly part-time coordinator to supplement some of those duties. But at this point, I'm looking at a part-time coordinator, part-time support staff position that can actually be a support to everybody in the office. And with that position, it would be an FTE, full-time employee. So 3 full-time positions is what I'm recommending to the board.
So,
anything you want to add?
well, no, just for clarification, the full-time, but the coordinators and then / support. So that'd be the same person. You're not going to have 2
Right.
part-time.
It would just be 3 full-time positions.
Thank you. And I know we've probably got some, as part of this transition period, there's probably a little anxiety in the room. We want to dispel as much of that as we can. I guess as far as I look, what we do as a county when we hire, we do have to, and I'm assuming it'd be the same way, we do have to put out notice, take applications. It's just what we have to do as part of that. What I would look at, we would want to do, again, in my mind, we're filling a part of a team is what we're doing. We've got a good team working now with 7 counties, bringing in another county that basically doubles our size. It is a big player. And again, I'm going to keep referencing the team. We need to have good people that'll fit in the team. I think what we would look at is, either way when we get to these positions, and we can talk about that a little bit later, but and I don't know whether this is too aggressive I would like to have notice, and I would think that would fall on Woodbury County to put notice in your local paper. Since it's Woodbury County person that would be contracting. This way, if I'm off base, please somebody let me know. That we would do that as soon as possible. For these, basically, if that's what we're looking at is 3 positions. I would like to have the applications due by the 15th of April. So that's basically 3 weeks. And then we would have a decision made on those positions by the April 30th. Is that too aggressive from the board? That's kind of what does anybody else have any other? Again, I want to get that out there. I mean, we need to let folks know that, what we're looking at, and I don't want to get this all the way pushing into June, where this ends in the end of June and not have anything. I want to get this done as soon as possible. That's why I'm looking at being a little aggressive on that. Is that okay as far as as far as getting it to your, and we can definitely, what we need for the ad, we can work on that to get you, so that can be done as soon as possible. We need to get that in right away to be able to have those applications, within 3 weeks, so.
Do you have the job descriptions already drawn up?
Yes, I do. And I can send copies out. I've got to tweak them a little bit to make sure that the requirements and qualifications for code are in there, especially for the advocate position, and I can send them on to you.
So our plan will be to deauthorize the current positions for this year as of June 30th, and then to authorize as of Tuesday's meeting the 3 new positions that are being recommended to be effective July 1st. So that works. That'll
On your end of it.
right.
Okay.
That'll be as quickly as we can expedite.
Which is good business practice, because right now you're under the contract with Stu Rivers, and it will be contract employees with Rolling Mills.
So yesterday, Sioux Rivers had their meeting, and that's when they said that, can you just go through that?
When you were at the meeting.
Yes.
So can you just give a quick description of what was decided or discussed in regards to notice or termination?
Notice for us?
Yeah.
Yeah, they just agreed that a letter would be going out, and they really didn't talk much about the letter, but then the letter would be going out that they would no longer need our positions.
Okay.
So they basically do like we do, where we contract, the region contracts with the county. I mean, is that how
Yes.
you're set up? So
Yes.
that's okay. Well, we want to try to stay in that same procedure protocol. So I guess, I don't know, to the board, do you think, is that a realistic timeline for you guys to have this all wrapped up within a month? And
I think the people applying for these jobs want to know as soon as possible too, so.
that's what I mean. We want to take that.
Aggressive.
I'd like to take that influx out. I just, again, and I don't know, at some point too, we have to, when we all came together as our 7 regions, or started with 6, and, we had the coordinators. There were some growing pain issues, and we're going to have the same thing. We're doubling our size, but we need to, my thought is, at some point we need to get some continuity. It happened over time, and I assume I'm positive it'll happen again. We'll get the continuity of the group together, but again, I'm going to go back to, I think we have a really good team right now, and I think we can add good people to that team and move forward, and that's what I want to, how we would go about. I think at that point, also that maybe a couple folks off of this board, when we get to those applications, should sit in on the, it's odd, I guess, to me, because if technically they're a Woodbury County employee, but I still think a couple folks off of this board should sit on, you know, if there's those additional interviews or whatever, if we have to do them, or see where, we'll know more once we get the applications, obviously, but, you know, we've got some good, I think we have some good people to fill those spots, so but we need to do our diligence and go through the whole application process. So, you know, I don't know if there's anybody else wants to make any comments or anything on that, or how we move forward with that.
Well, I think we kind of need to follow that timeline, otherwise we're going to get, you know, dragging out too close to the actual date when we're going to make the transition. So if we would have our applicants, the applications in by the middle of April and basically be able to come back to this board toward the end of April with a recommendation to Woodbury County as to which ones we feel would be most, would fill our need in the best way.
Well, okay, I did say the April 30, but we wouldn't have, what do you think, Dennis, would we need
I don't know.
that before the end, or would we have that decision made prior to the end of our
Otherwise
next
we get to the
meeting?
end of May.
Yeah, we wouldn't take action till May, is that right?
I don't know.
So
Would it
maybe
be possible to have it wrapped up in time for a board meeting in April?
Depends. I mean, possibly, if we have a fast track interview process, might be able to do that.
Well, certainly, even if we have one or two of the three filled, whatever is filled prior to our April meeting, we could have action on at our April meeting.
I would, yeah, I guess the 30th isn't gonna, maybe we need to move that decision, or the interviews done, and, well, because they won't officially, in my mind, won't officially be filled till the next, or till we act on it, is that right?
Right. Going back to what you stated, Palma, about Woodbury County, their employees of Woodbury County, that we would do the hiring, it allows for that for 2080.
Okay.
It states that the CEO may employ or contract with persons or entities, including contracting with member counties, for member county employees to provide services to the region. So the responsibility is really on the government's board for designating staff, even though they are going to need to be a Woodbury County employee.
Okay. And that, okay. So tell me, do we need to move that up then prior to our next, do we have to have that decision made then? Will be official at our next meeting? Or not have to?
For the
Yeah,
staff,
yeah.
I think it's possible that we can get that. I don't think we need to move it up.
Okay. But in our April meeting, this board will be able to take action on
Right.
3 folks. Okay.
Designation of staff.
Okay. So instead of April 30th, we'll put as, we want to have those positions filled at our next governance board
Well,
meeting or not?
maybe I'm wrong, but we'll make a recommendation. The actual filling, though, will still be done by Woodbury, won't it? We'll make our recommendation.
No,
Well, they'll be employed by Woodbury County.
Okay.
They need to be hired as of July 1st because their employment with the region is ending June 30th, so they would need to be designated as Woodbury County employees as of July 1st. But as far as action here, that wouldn't necessarily need to be the case because this doesn't join until July 1st.
right. So everything would take place and Woodbury's not going to have a vote on who we...
As I understand it, right, 2080 has you doing the hiring, but Woodbury is gonna pay both the salary and the benefits. Are you up to date on what benefits they will provide as far as insurance and everything? Or is a Woodbury person going to go through their interview process, or?
Woodbury will participate in that, in the interviews, yes.
Because according to 2080, as I understand, you were going to the hiring, but Woodbury's going to do the pay and the benefits.
Right. They're just the employer of record.
So there needs to be some
Yes.
coordination between.
For sure, there will be.
Am I missing anything?
No.
Any other board members have any other questions on this? I may need to call on a couple of you to sit in on the interview, so if anybody can let me know if you're willing to do it, we'll go that way, but I would appreciate that. Okay, so we can move on from there. Anybody else have any questions? Then next we'll get into new business updates. The FY20 annual service and budget plan.
I did not make hard copies of this. I provided you the budgetary portion of the annual service and budget plan because you have the electronic copy. If you prefer a hard copy, I will gladly give it to you. But it was 22 pages long roughly, and I knew it would be a ton of copies, so I only provided you with the budget. The first section of our service and budget plan, which is due to DHS by April 1st, and it's subject to the approval of the division administrator, Rick Schultz. The first section under regional access points, the only thing that changed there is that I added the Woodbury County access points. Woodbury County providers, if I'm missing anybody, let me know, but I've got Siouxland Mental Health Center, Mid-Step Services, New Perspectives, Goodwill of Great Plains, the Center for Siouxland, Crossroads of Western Iowa, Developmental Services of Iowa, and Opportunities Unlimited. Anybody I'm missing? Where'd you go? Sounds good? Okay. And then the next two sections refer to targeted case management, which the majority of the coordination for our region is done through our MCOs, which are integrated health services. So we have one case management provider still within the region based out of Calhoun County for targeted case management. Crisis planning, this section was updated to include the contract with Siouxland Mental Health Center to provide for same-day crisis services, med management, mental health court, peer-run drop-in center, or the crisis stabilization residential services through their assessment center, and 24-hour crisis response. We are going to be contracting with Counseling Services, LLC, Siouxland Mental Health Center, and Plains Area Mental Health Center as our emergency services crisis providers. I'm just going to go through some of the changes that we included. As far as crisis planning for individuals with intellectual disabilities, just wanted to remind you we are utilizing the iStart program now for crisis situations with the people with disabilities, and Felicia's going to give us an update later today on that. Part of the strategic plan, because in the scope of services section, we have to look ahead and see what we are demonstrate what we are intending to meet in terms of core services. So I included the strategic planning minutes from our January meeting, which clearly delineates our task forces for mobile response, intensive residential service homes, and the access center going forward. So for 2020, those are going to be our top 3 priorities in terms of guiding services to our Rolling Hills region. And with that, we have to have funding designated, which in our budget, we did include between Woodbury's portion and our 7 counties, $600,000 that is earmarked for service development. To go higher if needed, we do have the levy capacity that some regions don't, but at this point, we are not looking at increasing our levy to meet that. The next, what you have, I don't know if you've had a chance to go through the budget and have any questions. What you're seeing in terms of this grid is the budget that you approved in January. And I had to put it in this form because this is what is posted on the DHS website, and this is the referred document. If you get to the last page of the expenditure budget, which is about 2 pages in, right before the revenue sheet, I just wanted to point out that our total expenditures, which just for services is $6,841,23, and because of the transfer dollars between the counties and the region, those need to be pulled out. Even though we pay it as an administrative expense, that needs to be pulled out of that amount. So when you add that amount to the $6.8 million, it's $605,713. which totals $7,444,836, which is our total budget for next year. And then, questions about expenditures, or did you have a chance to go through that? Anything uncertainty? Or I'll just keep going. Stop me if you need to.
So the 7,373,000, that's the 6,840,000 plus the 605.
The $7,373,000 is the distribution from the fiscal agent to the member counties. This is the first year you're seeing it differently. Every year that I have done budgets for DHS, I send this off to them. They don't like the way the dollars are earmarked because what DHS wants to be able to easily identify are the transfers between the regions, which are those last two chart account codes, 13951 and 14951. Whereas in prior years, I've always included the transfer from the regional fiscal agents to counties in our total budget. Now I have to separate that out. So I just wanted it to be clear that our budget target did not change. It is still the $7,445,836. It's just that those dollars need to be pulled out so that DHS can identify the money from the counties and to the fiscal agent. And vice versa. As far as revenues, which is the next sheet, our total property tax levy for the region is $4,821,932. I did designate the $1 million in here as far as intergovernmental revenues, and that is the amount that will be contributed, $1 million from Woodbury County as part of our memorandum of understanding. I did include in the revenue projection the other county taxes, excise taxes, utility taxes, state replacements. So those are all designated here for total revenue, $6,523,729. And in addition to our fund balance at the top of this sheet of $3.1 million, our total funds available for FY20 are $9,679,073, of which needs to cover that $7.4 million budget. So if you, the fund balance, this is one thing I don't care for in this form because it's skewed as far as what they have for a projected accrued balance because we will not have 2.8 million sitting there. If you add the 605,213, which are the transfer dollars that go to the counties, to the expenditures, it brings us down to a $2.2 million fund balance as an aggregate, which is where we wanted to get at the end of FY20 with Woodbury County. So to me, this is not clear, and that's why I'm talking you through this, because I wanted it to be clear that that $1 million is counted for, and we're not going to end up with a higher fund balance than what we did when we completed the budget. Questions so far? Okay, the next sheet that you have just designates the county levies and the per capita. When I set up the first version, I had neglected to include the property tax asking for Woodbury, so I revised the sheet that you're looking at now to include that. And total revenue for the actual levy, not including fund balance, between all 8 counties is $5,106,446. And just to clarify, that actual levy per capita, it's variable depending on your population and your tax rates. However, it's an equal contribution of what we set up for the 3363 for Woodbury County and the 3150 for our Sunny counties. Is that right? That's what we landed on. I have to go back and look. So. Financial questions before I go on? Oh, 3075. I'm sorry. I knew it was close around there. 3075 is the per capita target for the rest of the counties next year in comparison to the Woodbury per capita.
30, what was that?
3075.
75?
Yeah.
Wasn't Woodbury's 33 something originally?
3363 for Woodbury, and we are at 3075.
This will get them down to that. a
Yes.
year for the following.
Right,
It will all be at 3075.
yes. And the next section of this is the financial forecasting measures, and that is also spelled out with Woodbury County and the intention to have us spend our balances while we're having the opportunity next year to do that, to get closer to the contribution threshold requirement that we currently have. And that I just spelled it out in our plan that this is a 1-year unequal levy, so that DHS understands that in subsequent years, all capital contributions will be on an equal basis. So that is all described in here, so it's clear. And the last section of the plan is provider reimbursement provisions, which I did not make a lot of changes to outside of I added clarification in there that for Woodbury County coming into Rolling Hills, we will need to send notices to the Woodbury County providers prior to July 1st, letting them know where they need to send claims, who their contact people are as far as coordinators for services next year, just so that they understand that all the claims will be paid out of this Sterling office in a centralized manner, and just so that there's not a bunch of confusion after July 1st. We want that to be clearly laid out before the start of the fiscal year.
We didn't address that in the staffing, the claims version. That'll be
Oh, you
later in
mean
the year, but that's fine.
the people in Woodbury?
Well, it'll be in BB now.
Right.
Is there any other, are there any questions for Dawn on our annual service and budget plan?
I just have one. When you go down here on the page that says county level, levy / per capita, and we get down to the region, says actual levy per capita for the region is $11.08.
If you take the last
The
page.
last page of the
No.
sheet.
Okay, yes, your actual levy for Cherokee County is going to be your levy rate 2210.
Yeah.
Yes, so there's varying levy rates in the counties to be able to spend your fund balance down and contribute at the same time on a per capita basis.
Understand that, but when we get down to the bottom where you average it all out, is that $11.08, correct?
Well, no, it's not. It's a formula, thank you. I'll take that out. That's one change we can make. But, yeah, because we don't levy.
Does that 2.2 fund balance, is that 2.2 million, is that down to the 20% then?
That has to set the 30%.
That's at 30%. And they are talking about 40%, right? Yeah.
So the actual, instead of 11, should be the 25.83. That actual, that $11.08 one figure we're looking at. That
Oh, the
actual,
region?
yeah,
That's just a formula that's in that Excel file because there is no, well, if you take the actual per capita.
And divide that.
5 million, that's what it equates to is 1108 in actual levy across the region. But we don't levy as a region, so it's an absolute figure that needs to be.
okay. So I was just taking the 5 million divided by population. That's not how we're coming up with that figure.
It does.
So it'd be about 25,
I can look.
25.83.
Let me look at the cell and see how she has it written.
But that again, but that's, yeah, you're right, that's, because each county's
Yeah, it'd be
Good
different, but I mean, it's
Yeah.
$11, there's no way we raise 5 million.
You were
No.
100% correct, it's 2583.
Yeah, okay,
If you look at it that way, it's 2583.
okay, yeah, but it's still
And the
each county.
1108 would have been the figure before I added in Woodbury's levy.
Okay.
To the calculation.
Thank you.
And printed it off.
All right. Okay. So, any other questions for Dawn on the budget plan or the service and budget plan? Do we need action on that, Dawn, or just, is that informational?
Action.
Okay. To approve this, oh yeah, because you want to have that sent in by, okay. Is there a motion to accept the FY20 annual service and budget plan?
So
As
moved.
presented. Thank you, Dennis. Is there a second?
I'll second.
Thank you, Kristen. I have a motion and a second to accept the FY20 annual service and budget plan. Any other questions or comments? Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Okay, legislative update. That'll be fun.
Okay, first one is House File 690. This has passed out of the House as of last Thursday. The children's system, the children's mental health. There were some minor amendments. The majority of it surrounded or revolved around nomenclature. Instead of mental, they were behavioral. So there were just a lot of language changes in there, but nothing that really changed what the state board had recommended to the legislature in their bill. What this bill does is it codifies a children's state board to provide oversight for the development of the children's system. I'm just going to give you a quick summation of what they're looking at. The eligibility for children under the age of 18, they have to be a resident of Iowa. Family income equal to or less than 500% of federal poverty level, which is extremely generous in comparison to the adult system. It does not apply to intellectual disability services or brain injury services, and it does not include substance use and developmental disorders unless they co-occur with a diagnosable mental health or mental illness. The Children's State Board involves 14 voting members. I won't go through all of them. There are 4 ex officio legislators, but just to give you an idea, they're going to be primarily your AEA director for a school district, principal, counselor, Department of Ed is involved in that board, Department of DHS, Department of Public Health, Workforce Development, just to name a few. So it's going to be a very large board to provide oversight. As far as core services for kids, there are 8 services that they defined as core, and that is prevention, early identification, early intervention and education, assessment and evaluation, med prescribing and management, and behavioral health inpatient therapy, or outpatient therapy, excuse me. And also mobile response. So as we have our task forces starting to meet, we need to really be keeping in mind mobile response for children as well. Community-based crisis stabilization, as well as residential services or crisis stabilization for kids, and then behavioral health inpatient therapy or inpatient treatment. So there are some additional core services that if there are public funds available for that, we can fund family support, peer support, therapeutic foster care, respite care, and then some vocational services such as day half, job development, and then care coordination in health homes. So that's a tall order for a policy bill that obviously can't have funds attached to it. But at this point, I am hearing that there is no funding allocated for the children's system. At one point this past month, the legislature was looking at some federal block grant funding that is a pass-through from the states to the mental health centers to fund, they use it for evidence-based practices and some of expanding therapies, and they were going to scoop that funding from the mental health centers and provide the $3.2 million to the regions for the children's system, and I believe at this point that's pretty much off the table.
They haven't amended it yet, but the word is yes, it's off the table.
Uh-huh.
It could pop up again. We certainly hope that fight that. Those dollars come to the mental health centers. We use them for very specific purposes, including scholarships for those that are underinsured or not insured. That is why we don't send applications for services to regions. So it's, to me, it's, you're taking money from Peter to pay Paul. There's got to be new money infused into the system to pay for these services.
And I think we discussed that a little bit. If that was taken away from the center and given to the region, it would just create a whole nother bureaucracy of paperwork and,
Yeah, it'd be an administrative burden to.
Yeah, I was gonna say that
We
would-
would have to hire a whole other person to man just that grant because it's a federal
Right.
grant.
It also defines the division's responsibilities with assisting the Children's Board in developing the system. As far as the funding component of the bill, and I gave you a condensed version, so, and this was provided to me at a meeting I had attended previously, but it states that DHS has to ensure that these defined core services will be covered by Medicaid and that Medicaid will reimburse the providers when the services are medically necessary and no other third-party payer is responsible for reimbursement, subject to available appropriations. And then regions must pay for services for eligible children when no Medicaid or third-party payer is available up to a 500% poverty level. And until more funding is found, the eligibility for core services is limited to children who are in need of behavioral health services. So that makes me a little skeptical, simply because we are struggling getting enough funding for the adult system, and now they're adding the responsibility onto the regions for children as well. The governance board is going to change. They are going to add, in addition to the current representatives, they will add a member that's representing the AEA, a parent who's an actively involved relative, or a child, of a child. It's adults that can serve, and then a provider of children's services. So you're going to have 3 additional representatives, and they will be voting members, except for the adult. They kept the adult provider and the family member. No, just the adult service provider is ex officio, which right now is Pat Larson. So she can't vote, and right now Pam Hammerl does not have voting capacity. But they did change that one adult person who utilizes services or is an involved relative that does not explain or identify that they are ex officio. So you're going to have 4 voting members.
would that, I mean, so when you say that, they would or wouldn't vote on, I mean, would this just be a combined service, or are we going to have separation between juvenile and adult? So would they be voting on,
You have one
say,
governance board.
right now?
Yes, you have one governance board overseeing 2 advisory boards, one for the children's system and one for the adult system.
Okay, but if
Or
there's
you could
something
choose to
that,
combine it. Right, but
Right.
you're going to have 4 new voting members between an adult representative, the AEA, a children's provider, and a family member of a child receiving services. So you will have 4.
but my thought is if we get to this and we have a X amount of dollars we have to spend, that could change it. Instead of spending it on the adult side, it could possibly be nix a service for the adults and put it to the juvenile.
Right. And as I said, there's no funding for this bill. It does require that the regions have a service plan to the Department of Human Services for implementation of the children's system by April 1st of next year. So I look for this to be passed probably pretty soon. And we're going to have to start working on the task forces concurrently with the children's system.
And this will all be in place by 2024, is that, am I correct in that?
No, the plan has to be to DHS by April 1st of 2020 for an effective date of the start of the children's system July of 2020.
2020.
Yes. So the regions will coordinate the system by July of 2020.
There may be a little fudge in that, because DHS has requested that the rules not be quite as fast track as what there was for the
So we can have an extra year.
possibly.
Okay.
I mean, there was quite a bit of discussion in our last commission meeting about this bill. And DHS said there was such a challenge to get the rules out for the comprehensive multi-occurring work group
Okay.
that they wanted it to be a little slower paced for the children's side.
Well, it appears to me we actually lost ground in having our carryover percentage of balances increase, because after 1 year of the children's mental health, we'll all be sitting there with not much money to work on.
Well, we wouldn't anyway, even just funding our services for the adult side. We can't even afford that, right?
I know, and this is going to accelerate it.
There was a fiscal note attached to this bill that designates next year, it's projected across the regions, across the state, 3.2 million in funding for the children's system, and then in FY21, 5 million.
Across the
Regional
state.
funding, statewide, because of the Medicaid funding.
Skeptical.
What's the plan for getting more kids on the mental health waiver?
I have not been involved in any discussions about that. I just know that there's an extensive list, and that's all I've heard. Just our regional one, what did we calculate, 100 kids on the children's mental health waiver?
The waiting list.
On our
The waiting list. at
7 or
DHS,
8 counties.
Or 8 counties, there's 100 kids.
Do the children have to have an IEP in order to be evaluated, or does every student get evaluated?
No.
They don't have.
They're not referring to students as, unless we identify that we're going to have a screening process for all the kids going into school for a behavioral assessment or some kind of a screening. That is not required. This addresses children with serious emotional disturbances. So it's going to be those cases where children have a lot of needs, I think is the intention, and that we're able to assist families with getting the care that they need.
They may be preschool.
Could be. It's 0 to 18.
Yeah.
Okay. Any more thoughts or comments on the, this is House File 690, is that correct?
Yes.
That's at 691.
Okay, that's the next one. That's the fund. That deals with our fund balances. Senate study bill. Okay. All right, anything on children's mental health? Anybody have any more comments or questions? If not, let's move on to the fund balance legislation, House File 691.
This was passed last Thursday unanimously out of the House with no amendments attached to this bill. It removes all of the population thresholds, which were very damaging to regions, and increases the fund balance threshold to 40% instead of 20 or 25%. It allows regions that are going to be in financial hardship to recertify their budget for cash flow purposes. From the effective date of this act, they only have 30 days to move on it. It has to be certified with the county auditor within 30 days. I had sent out an email to you as a board when I knew that this was going to be a possibility to go to the 40%. I just received feedback from a couple of the supervisors that were not in favor of doing that. I don't know if it warrants a conversation. We are fortunate that we projected to end with the 30% fund balance, so we're higher than even the 25%, which I'm comfortable with. It's easy for me as a CEO to say, let's capitalize on all of the dollars that we could utilize next year and then increase our fund balance for subsequent years because of the children's system, but I know it's not going to be available to taxpayers to do that. So if you want to have any discussion about that, I only received feedback from 2 supervisors, so just I'm throwing that out there. It does allow us to, we've got 2 more years before we have to recertify our fund balance with the Department of Management. So I had the timelines from Senate File 504 hardwired in my brain for 2 years, 2 years almost. And now I have to change courses. It used to be in the old legislation, we had until July 1st of 2020 to get down to the 20 or 25%. And then we had to certify our budget or any balance to the Department of Management by December 1st of 2020. Those dates are moving back 2 years. So we have 2 additional years to get down to 40% and then certify our fund balance with the Department of Management by December 1st of 2022, which the year that allows for property tax relief would be the fiscal year starting July 1st of 2023, ending 2024. So that is the year that you have to be down to that 40%. It's not going to affect us because we were into the 30% already in our budget, so we aren't going to be affected by that. We're just going to work those with the due dates. Legislation. So it was favorable that, from what I'm hearing, there is no discussion or support for lifting the caps on the county levies across the region, and so I know that ISAC is advocating for that on our behalf. CEOs have been getting ears of the legislators, especially those that are going to be broken a couple of years, but I am hearing that it's not going to be supported. I know that Senator Feenstra, from what I understand, is looking at some other funding mechanisms. Shane, I visited with him on Monday, and he mentioned some backfill money, and I didn't know what he was even referring to. There is no backfill, so I don't know. And then they've looked at state or local option sales, not local option, sales tax versus property taxes. So I don't see anything forthcoming this session in terms of cap levies being lifted. I think it's still going to be property tax.
Okay, any other questions or comments on that? Okay, let's move on to subletter C, I start. Are you ready?
Yes.
Okay.
My name is Felicia Bates. I am the iStart Program Director as of January of this year. I've been with the program since it started in County Social Services in November of 2015, so I've played a bit of every role there, so I feel like I've got a good idea of what our program does, but I'm not sure who all was here last time we presented. So a little overview of iStart. We work with individuals with intellectual disability and co-occurring mental health diagnosis, and then some sort of challenging behavior. We'll go kind of on the reasons for enrollment, but typically there's a lot of aggression. They're at person for losing placement, self-interest behavior, things like that would initiate referral to our services. And what we do is then we work with that system of support to improve their ability to support that individual by understanding their diagnosis, helping create a crisis plan, working on prevention efforts, working with the hospitals, mental health centers, doctors, anybody involved in their care to better understand what might be causing crisis to better assist that person through it and hopefully prevent it. We had started in this region last March, and we since have really made some headway we did guard the initial coordinator we started with, put in their notice a couple months after we began here, so we, as part of our services, did what we could to cover the cases here, and we're still receiving referrals. However, we did start a new person at the beginning of February who now has just taken it and ran with it. She's absolutely amazing. And her name is Morgan. She was going to be here actually today, but she's a little too busy with some of the things that she was doing, so she felt it was best that she go support those teams she's working with. Right now in this area, there's 13 cases. It sounds like it's not a lot, but the intensity of the cases that we serve require quite a bit Right now, until there's a certified coordinator, it's capped at 15 cases that she can actually have. However, we're working on ways to enhance the capacity so we can be taking more cases. She's actually just received 3 in the past month and a half that she just started doing some intakes with. Some other things, this bigger handout here with some of the graphs is a program update as a whole of the iStart program. I'll talk into some specifics of this region, but just some bigger things to note. This was ran at the beginning of last month. We run these about every quarterly, every 3 months. Currently supported, it says 86, but it's out actually now to 92. We do, it's kind of an ebb and flow thing where when things improve, we deactivate when the team feels it's time. A couple of other big things to note. You don't have the last report, but previously case managers made about 70% of the referrals. Now it's kind of shifted to 20% more of residential providers are making referrals to our services, which to me is saying that they're receiving our services and then they're making referrals because they're finding benefit from that. So that's a big improvement that we've seen there. It kind of, the front is just some demographics of people who are referred to our program. Where we're currently serving county social services as the 22 region county. We're here, and then we're also in the cross region. I'll get to talking a little bit more about expansion as well. You may see that the main reason that that people are typically being referred to our services is because there's some aggression there, and they just need help to better understand why there's aggression, how maybe to prevent it. On the back, it just kind of goes through some of the psychiatric diagnoses a lot of the individuals that are being referred to the program have, as well as some medical diagnoses. Crisis intervention outcomes, this is kind of the cool part that it shows when we get our referral, we ask for the past year of hospitalizations and then even 5 years, whether emergency departments, inpatient. And what we're seeing is that once enrolled in services, we're seeing a decline in those, the emergency crisis services. We hope to always avoid unnecessary visits, but we know that that's also a work in progress, and it's kind of a moving target, but we are seeing improvement within all of our program. A lot of times with crisis response or when they're calling our crisis line, we've seen we've been able to assist those in maintaining their residence as opposed to going to the emergency department when it's not necessary, and we're able to assist at the home. The last thing looks at it's called the ABC. It's a Aberrant Behavior Checklist, and what it does is it looks at the intensity of some behavioral health issues, and we take it at intake, and then we take it every 6 months I'm trying to say here. And what we're seeing also is a drastic decline in those scores, and I have just some information on one specific individual that we've worked with and their team. Some of his outcomes is within the first year before he was referred, he had 3 emergency department visits, and then right when we began working with him, he had 3 more. But since November, when we were able to identify that those visits always followed a psychiatric medication change, and he's having adverse side effects. He has not been to the hospital one time. He has, his incidents of aggression have almost dissipated. There aren't any anymore. The last meeting we had, he's a rock star. I referenced a meeting that we had prior to that, that they were saying, we just want our old, so-and-so back. We're not sure what's going on. And when I mentioned that at the meeting, they said, this is a new and improved. He's better than he's ever been. He's happier than he's ever been. So that was kind of really good to hear. His ABC scores, so this last thing that we were looking at here, this hyperactivity out of 45 possible. At his intake, he had 31, so he almost scored the highest that you can get. At the most recent evaluation, he scored 19, so it halved, and that was even 2 months ago, so it's probably lower since as well. Hyperactivity, out of a possible 48, he scored a 19. The last time we reviewed it, he only scored a 1. Some other things that we're doing, we've been providing trainings in the area. We do what's called a clinical education team, and it's a monthly training that travels around all of the START services. However, we have started remote sites, so no matter what, there's always a spot here that it's kind of like a satellite site where folks can come and participate in that training. The next one actually live in this area is in June. If you guys if you're not on the mailing list and you want to be on the mailing list, let me know, and you will always receive invites to all of the trainings that we provide. There's also been, from September to April, our national team puts on a national online training that we host again. They're offered, attendees can get free CEUs, and it's all on mental health and intellectual disability. Actually, the attendance here has been really high. There's always been anywhere from 5 to 15 people attending, so that's really positive. It runs through September to April, so next month is the last one of those, and then they'll restart again in the fall. We've done several just agency trainings, whether it be individual specific or disability specific. Jim Abert, our previous CEO, has worked to do some agency-wide trainings. Wesco has asked us to present at their staff conference that they're having this year in July, and so we're working to present a few topics there. And if you have any trainings that you guys want in this area, or anybody wants, we offer trainings no matter if you have a client with that agency or not. We just want to be able to improve the knowledge of everybody supporting somebody with intellectual disability. Let's see, some future things that we're doing. One thing that we're working on is linkages, working with different providers and agencies, hospitals, to improve our working relationship, making sure that we're all on the same page and understand our services, and so that we can better support them. Some other things, every year we do a perception survey, so anybody who has utilized this service at any capacity, we offer the ability to take a survey just to give their feedback and make changes as we see necessary. The last one was done May of last year, so this will be done here in the coming months. We're working on more trainings in this area. Morgan will be nationally certified. It takes about 12 months to be fully certified, and so she's about 2 months in. And I have no reason to believe that she wouldn't just pass with amazing colors on that. Some other things to note is, as a CSS region, we're working on sustainability and how do we cost share what the program costs to lessen the burden on any one region. Some things that we're hoping to do is we're working with the East Central region right now to start services there. That's hopefully coming soon. There's been a lot of talk. They're going to be putting that on their board minutes, and that would lessen, hopefully, the cost that anybody would pay or any region would pay. We are getting referrals and requests for consults from all over the state, meaning that people are hearing about our services and they're also wanting the program there. So that's just good to know in terms of expansion of the program. Jim is actually our old director, is working a lot with Medicaid and seeing how we might be reimbursed for some of the services to again lessen the cost of our program, or see if we can get it into the Medicaid menu. Bob is working diligently to see how he might be able to wrap the START program around the IRSH, I don't know the exact lingo, requirements, so that that you guys would already have a lot of what's needed. He's working really hard to try to help us see how we can provide that service. And I guess that's probably the bigger updates. If anybody has any questions or comments.
I'm just curious, where have the majority of referrals come from? You mentioned providers, but what providers are we referring to right now?
We have quite a few at Wesco, Opportunity Living, and those are the bigger ones. I'm trying to remember. Yeah, we have quite a few. That's where the majority of them are. There's a few other sporadic ones. Let's see, probably at Wesco.
In total, how many cases have you had out of our region since it started?
So I don't think we've been activated anybody yet. So, and it is a slow growing thing. Initially, it takes about a year to get to about 20, and we're about there right now, so it's been about 15, I would say. But it's a good and a bad thing, because what we're trying to figure out now is how do we, and even for county social services with the geographical spread, cover cases when maybe there's a turnover, cover cases when that coordinated capacity to be able to really provide those services. Bob and I are working on trying to figure out if we can hire an additional person that maybe has a lower caseload but that travels half of the service area so that they can pick up some of those. I foresee quite a few more in this area, and we also have to think about Woodbury coming in and doubling the size of this area. I'm sure that that's going to be a conversation that we have once we reach capacity there. Is there any other questions on the program in general, what being here, or?
Just one more question. All of the cases that you've had, have they all maintained replacements?
All but one, I think. However, they were able to find out after they discharged, and that we were really advocating for is, well, I don't want to say that. There was a lot going on with a lot of things, but there was a medical concern that was unknown. They had a urinary that was increasing symptoms that caused a pretty big crisis, and they didn't feel like they could serve them. However, afterwards, it was found that they did have that, once that was addressed, their mental health improved. So I think as far as that, I don't know of anybody off the top of my head that has been discharged. However, that does sometimes happen. Sometimes we get in when they have their hands tied and they feel like there's nothing left. I don't think it's happened here in this region yet, though, besides that one.
We're talking about the national conference.
Yes, and so part of what we do, the START is a national program that we're implementing here in Iowa. It's in 10 other states, and they throw or host a national conference that's open to anybody, anywhere actually, but they really encourage START teams and START coordinators to attend to improve their ability to implement services. I've attended in the past, I've attended twice actually. Our board has approved half of our team to go and then rotating each year. We're also contracted with Cross right now, and they've approved the coordinator to go. And so we're asking if the coordinator here would be able to go to that in May. I think it's already was worked into the contract. If you look at the last page in your guys' handout, this is something I created a while ago that I presented to our board just to give you an estimate cost and a breakdown of what the conference costs, what it entails. There's more information on this conference on the Center for START Services website as well. But as of, it's kind of hard to put an exact cost on it just because, flights vary, the mileage, depending on what airline you go with, luggage can vary, things like that. But this is, I think, as close to the estimate as we can get. So that's in May 5th through 8th is the dates that they will be traveling. The conference is 3 days.
And we did approve the travel training as part of the contract that they submitted when we approved their request. So it is included.
Who's our coordinator?
Her name is Morgan Detbar.
I would advocate for this person to be able to attend the conference because of the value that they'll receive in the training, as well as the fact that we aren't going to come close to our allocation that we had put it into the budget this year for the iStart program, because they had some period of time where they didn't have a coordinator, so they were trying to hire, so we're not going to come close to the budget.
And with that, so you guys know, there was about 2.5, 3 months where there wasn't a coordinator, and it's as a region trying to find someone in our region trying to find the reason that there was such a lapse is we were going to different counties trying to find a record of employer to employ someone that's not living in the county, so that's why it took so long. Right now, with CSS as a back note, we're trying to do one county employer, so that wouldn't happen again. That it wouldn't take 2 to 3 months to hire somebody. So that's why there's just a great time. And while we did that, we did our very best to cover those cases with travel. Jim Paper did a lot of work down here.
So we've already been planning for this, budgeting for this.
Right.
So-
Do you need a motion on that then?
So is that, are those numbers still good, that $1,500 or $1,600?
I looked at the airfare a couple of days ago, and it went up 50, and then the next day it was down back to this. So it really just depends on the day. It might adjust, but everything else is pretty accurate. Actually, the miscellaneous cost is probably a little high, but you just never know with whichever airfare, whatever makes sense for them to drive out of the mileage and whatnot for that.
Okay, so Morgan is the coordinator for our region.
Yes.
And we would be paying for her to go to this conference, but she would work just exclusively in our region, is that correct?
Yeah, she's officed out of Sac City.
Okay.
Yeah.
Okay.
I'll make a motion to allow Morgan Detmar, is that
That barn.
Detmar? To go to the ISTAR conference in May.
Okay, is there a second to that motion?
I'll second that.
Thank you, Scott. I have a motion and a second. Is there any other discussion or questions or for Felicia or anybody? Okay, hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Okay, anything else or anything that's come up in discussion anybody else would like to ask questions about? If not, we'll go ahead and we'll set the next meeting. We're looking at April 24th at 2:30 in the same location. We got a problem with that date? Okay, let's plan on that for right now and see what we get. I'm here They'll have a quorum. We might have to do a phone. Okay, do we want that in a motion setting the date?
Well, you would just have to do that.
Okay, is there a motion to adjourn?
So moved.
Second. Boy, you guys are quick on that. All right, did you get those, Louise? We are adjourned.